So don't come alone, right? Like when we have standard therapies like chemotherapy, radiation, target are not having the luxury of having cancer alone. Most of my patients come with a combination of cardiovascular abnormalities. Medical oncology cannot support such kind of patients because of their poor cardiac health. For such kind of particular therapy called keystone therapy. So it's a combination of two different functional medicine therapies. Patients in such kind like who come with a very poor cardiac function, like let us say the left ventricular hypertrophy, or is having a poor ejection fraction. Hello everyone. Treating cancer patients is one of the most challenging things which we have, because like many a times cancer don't come alone, right? Like when we have standard therapies like chemotherapy, radiation, target therapies which is there for the cancer patients. However, giving a chemotherapy or giving a target therapy or immunotherapy depends upon whether the patient is having a perfect health condition. If the patient is only having cancer, they may be eligible for all these particular therapies which I told, just like that. However, many a times most of our patients are not having the luxury of having cancer alone. Most of my patients come with a combination of cardiovascular abnormalities. That maybe you will be having some heart blocks which is untreated, or your age is not supporting for you to go for a cardiac treatment, or like something like a stenting, or you're putting a bypass surgery, something like that. At that point of time, these patients become a no option patient. Conventionally, medical oncology cannot support such kind of patients because of their poor cardiac health. For such kind of patients, integrative oncology is something which is very promising. So we operate a particular therapy called keystone therapy. So it's a combination of two different functional medicine therapy which helps to improve the cardiac function, and which helps the patients who are having cardiac problems, who are not able to take chemotherapy or radiation or surgery. They can initially undergo this keystone therapy. What is meant by keystone? Keystone is a combination of something called chelation therapy and ozone oxygen therapy. So through chelation, we try and remove the heavy metal blocks which is there inside the patient's body. It removes the blocks inside the arteries and ensure there is a free flow of blood circulation within the clogged arteries. And alongside, most of the conditions inside the body, including heart conditions, are because of the hypoxia. That means the lack of oxygen. The ozone therapy is one of the known therapy used for improving the oxygenation levels inside the body. So while combining both the chelation and the ozone oxygen therapy, we can revive the heart condition of a patient who would be requiring a therapy which is very much pressing for his health conditions like cancer. So we have many patients in such kind like who come with a very poor cardiac function, like let us say the left ventricular hypertrophy, or is having a poor ejection fraction, which prevents him from getting the deserved treatment what is supposed to be getting for the cancer therapy. So keystone is a very promising intervention which combines both these particular marvelous functional medicine therapy to revive the patients with cardiac function and improve their condition, and to bring back their much needed cancer therapies for them. Thank you.